Welcome, everyone. It's really nice to see folks. Thanks for joining. As always, if you're able to turn on video, we love it, and I understand that not everybody can. We're going to start with a brief mindfulness while some folks are still trickling in. So for today, I was hoping that folks could take a moment, maybe put down anything you're holding or sit back in your chair or step back from your desk a little, whatever feels comfortable or possible, and take a breath or two. You to bring to mind somebody that you are grateful for. This could be somebody who's close to you. It could be somebody you don't even know very well, like the barista at your local coffee shop. Just hold them in mind. Maybe think about some aspects of their personality that you're grateful for, kind of name those silently to yourself. Bring to mind an experience that you've had with them at some point, and what was important about that for you. Finally, taking one or two more deep breaths and then bringing yourself back to the space. Thanks for doing that today, and I'll turn it back to Lauren.
Thank you so much, Lindsay. That was a great mindfulness and also a tool that you can maybe use in your practices if you notice that your patients or their parents or your colleagues, whoever you're working with, may need some time to reset and ground. So today for our Skills Echo Didactic, we have our hub team member, Dr. Lindsey Bruett, who's a psychologist on our CalMap team, who consults with families and providers of children and adolescents. Dr. Bruett's areas of expertise include evidence-based treatment and assessment of eating disorders, anxiety, depression, disruptive behavior, trauma, and OCD. She highly values the importance of including family when supporting young people and specializes in parent-based interventions. Dr. Bruett has extensive experience providing care and consultation across the socioeconomic spectrum and is committed to continually striving to reduce healthcare disparities caused by systematic oppression. She loves partnering with providers and families to support mental health. And so Dr. Lindsey Bruett is going to start us off today talking about one particular distress tolerant skill. We're really going to go into depth with this one tool. And then at about half of the hour, we're going to turn it over and ask if anyone has a case, a patient, a family, a student that they think could benefit from some coaching in a skill like this, and we'll kind of brainstorm all together how that might go in your visit. So as Dr. Lindsey Bruett is going through her didactic today, kind of really think about how this might play a role in your practice, and if you'd be willing to brainstorm that together in the second half of the hour. Without further ado, I will turn it over.
Thank you so much. And are my slides looking okay? Great. Okay. Thank you all for joining today. So a couple of announcements first, just a reminder that we are CalMap and we offer free, timely, personalized consultation during business hours, and you can reach us by calling that number on the screen, or you can reach our online portal through the QR code that you see there. Our child psychiatrist would love to speak with you. We, as psychologists, also consult about mental health topics, including specialty areas like eating disorders, substance use, autism, etc. And we would love to speak with you all. And mark your calendars for upcoming educational opportunities that we have. These are free as always. And our next therapeutic skills echo, that last one will be emotion regulation. So that's sort of related to the skills that we're covering today. We hope to see you at some of these. And finally, some information about our funders here at CalMap. Okay. So we're going to be talking about distress tolerance today. So who here, you could raise your hand, you could put it in the chat. Has anybody here ever been working with to support a young person or a caregiver and had emotions that escalated, that felt a bit challenging to manage? I see hands, I see nods. I know I certainly have, probably just like in the last few days. And so these are skills that really can be applicable in any of those contexts, and they can be applied to youth, to adults. I use them myself all the time as a provider. I'll talk about that more. So really universal skills. We'll be practicing a couple of those skills, and we'll be learning about some really concrete online resources that you can share with families. And Lauren, I can't see the chat well, so if there's anything I should attend to, please let me know.
Perfect. I was just going to ask everyone as we're getting started, if you wouldn't mind introducing yourself in the chat, sharing your name, your role, and your region. And it's really nice to see so many faces on camera. We really welcome that and appreciate that. Thanks, everyone.
Thank you so much. Okay, and so to start us off, so folks nodded and raised their hands when I asked if they'd ever come into contact with folks in their practice or in their day-to-day, maybe at their school or their physician office, where folks become dysregulated. And I'm curious if you could write in the chat, please, what are some things that make the people you work with dysregulated, meaning like have a strong emotions? What are some things that make you have strong negative emotions? What are the things that impact our youth, that make things difficult? I know we just asked you to do two things at once, so thank you for both introducing yourself and brainstorming in the chat. Waiting too long for an appointment, 100%. Yes, we can see families become pretty worked up about that. Yeah, parents having expectations and it's sort of outside of our scope of practice, or absolutely kids and parents fighting, disagreeing. I know I can get pretty, I've decided that I can no longer take meetings while I'm driving because I just get so frazzled and like annoyed with everybody, and it's nobody's fault except for the fact that I'm multitasking. Kids with behavioral problems and ADHD, yeah, it might be more prone to have more dysregulated emotions. That can be kind of a core feature of some of those challenges. Running behind, vaccine refusals can be certainly really frustrating. Issues with computers, technology, yeah, it probably feels like, oh my gosh, I have 7,000 things to do and now I can't remember my password to this website, or now I'm locked out of this system that I need to be using. Definitely word triggers, and that can cause folks to get defensive, trying to cram things into a short period of time. And yes, generally stress. We all have a lot on our plates, and that can create instances where we feel really strong negative emotions. Okie doke. So I want to introduce you to a skill called TIP. This is an acronym. TIP skills come from dialectical behavior therapy. So they were originally developed for folks with suicidality and self-harm, and often really strong emotion dysregulation, strong negative emotion experiences. However, as we were talking about, these skills are universally applicable. And so they really can be used in any circumstance where you're working with a human who's having strong and negative emotion, and either they want to change it or you want to change it, or you want to help them, to support them to change it. So these stand for temperature, intense exercise, paced breathing, and progressive muscle relaxation. You don't have to remember these words and specifically unless that's helpful for you. And we're going to go through what each of one of these means in more detail. Okay, so I first want to take us through paced breathing. This is sometimes referred to as box breathing, deep breathing. You know, there's sort of no magical way to do deep breathing, but I'm going to introduce you to one way today that I really like, which is what we call paced breathing. And so essentially, when we are revved up, our heart rate tends to be really high. And paced breathing is something that can help us to decrease our heart rate and sort of help down-regulate our nervous system. And so as humans, when we inhale, our heart rate increases slightly. And when we exhale, our heart rate decreases slightly. And so if we extend the amount of time that we exhale, we can actually help our kind of physiology to calm down, help our heart rate to decrease slightly. And so I'd love for folks that are in a place to actually practice this with me. It might feel kind of nice. And so, as I said, there's no magic to doing like particular amount of seconds or things like that. But what I like to do is gradually increase each step. So we're gonna breathe in for about 4 seconds, and then we're gonna breathe out for about 5 seconds. If that feels too long or too short, you can feel free to adjust on your own. And we'll kind of repeat that in a cycle for a little while and sort of, so before we start, just kind of take a notice of how you're feeling today. Check in with your body. Just kind of notice anything that's coming up for you. And then when you're ready, you can go ahead and breathe in for 1, 2, 3, 4, and breathe out for 5, 4, 3, 2, 1. In for 1, 2, 3, 4. Out for 5, 4, 3, 2, 1. In for 1, 2, 3, 4. Out for 5, 4, 3, 2, 1. I'm going to be quiet and let you continue for a few more seconds. And then bringing attention back. Thank you for practicing that. For folks who are able, is anyone able to unmute and share what that experience was like? You put it in the chat too.
It was kind of hard for me because I'm always I like something popped up on here and then I got distracted and so I lost my focus on the breathing and I was like, oh my gosh, I have to go back to breathing. So it's really hard to sort of like be still in my mind, I guess.
Yeah, absolutely. Thank you so much for noting that. And I can totally relate to that. I think it speaks to sometimes we can sort of optimize these experiences, right? From like turning away from our devices or putting them down for a moment. I made that impossible for you because we're asking you to watch Zoom while we're doing this. I find it really helpful. I'm going to share some handouts at the end that have an app resource that's totally free and doesn't require registration. And that can actually guide through paced breathing. So sometimes I find that really helpful, especially if I'm really kind of frazzled to have it guided rather than trying to do it on my own. Thank you so much. Does anyone else want to share? All right. So our next tip skill is temperature. So we know that temperature is also part of our body's regulatory system, and temperature can influence the functioning of our central nervous system, which underlies our emotion regulation, becomes activated when we're really having strong negative emotions. And so changing the body's temperature quickly can help to downregulate our central nervous system, can help us calm down. And that can be both with heat or with cold. We primarily use cold because it's usually easier to do that in like a clinic or a school or an office setting because we can keep ice packs on hand. It can be a little bit harder to do that with like a full body heat experience, like a bath or a shower, although you can certainly recommend that families do that at home because they would likely have access to those things. And so the idea here is that, and I'll just demonstrate this in a moment, but we are helping folks to, in this case, cool down quickly. And so what we actually have folks do is to take a bowl of water and put ice cubes and cold water in it and actually dip their face in the water. So I'm going to stop this screen share for a moment and I'm going to share a different screen.
Really like to use temperature.
Can you hear this and see it? And I can't see faces, so if someone could tell me verbally, that would be great.
Yes.
Yes.
I could hear her. Yeah.
Thank you. Okay.
Sure. There's some caveats with this one. Those are in the comments as well, or in the text under this video. You shouldn't use this if you have a heart problem or a history of an eating disorder, or if you're pregnant. But if you're not, here's what you do. You get a bowl full of ice and water. You can see I'm outside, so some of my ice is already melted, but I promise you it's really, really cold. And you take a deep breath and you put your face in it for as long as you can stand it, 10 seconds or so. Woo! I feel different already. I'll tell you right now. And I demonstrated that because it's one that people often don't want to try because it seems so crazy, but it really works. I'm already feeling my body calm down. If you think about if you actually fell in the ocean and were drowning, you would need to be calm and centered to solve that problem. And that's what this does. That's what tipping your body chemistry with temperature does. Call it an ice dive, you can call it the dive reflex. It's really, really helpful. And I hope you'll try one or all four of these things to get through.
Can I ask a question?
Please.
So for this exact demonstration, like, can you give me I'm a pediatrician, I'm
Yeah.
in a clinic, right? And am I like telling the 16-year-old, like, one thing you could try doing is sticking your face in ice water when you can't calm down?
Great question. So we are actually going to share some. So yes, you can absolutely do that. You can also, if your clinic has this set up and you have somebody who's dysregulated in your office, you can actually demonstrate it. So you don't have to use a bowl of ice water. You could also use 2 ice packs under the eyes. And so you could have somebody actually try that in the office. This can be done in schools and in our offices here as well. Or yes, you can absolutely sort of advise folks, when you go home tonight, I'd like you to make a rescue bag. So take a baggie in the fridge and fill it up with ice cubes so it's kind of ready to go if this happens, or prepping ice packs. We have some what we think are pretty clear handouts at the end, so we'll share those. So you can also keep those on hand and literally just hand them to the family. And if you want to walk them through some of the steps, you could absolutely do that as well. We've also linked at the end the video that I just shared. The whole video is 5.5 minutes long. So that's also something that you could pull up, share a portion of it in session, or give the family that link to watch outside of clinic. Great question. Thanks so much for that. Okay. I am going to share my screen again. Does this look like the right view?
It is. I think the chat's just covering your screen at the top.
Oh, yes. Let me change one thing. Thank you for that. Yep. Look okay. Okie doke. All right. So the next one is intense exercise. So I'm going to demonstrate how I might talk to a family about this. Could I have 2 volunteers? You don't have to prepare anything. I'm just going to ask you to pretend that you're a kid and a parent in my office.
I can volunteer.
Thank you so much.
I can also volunteer if needed.
Awesome. Thank you so much. So can one of you be the kid?
I can be the kid.
Awesome. And can you say your name? I'm sorry, I can't see everybody's faces.
Aisa.
Aisa, nice to see you, Aisa. Thank you. And then could our other volunteer be the parent?
Yeah, and I'm Peyton.
Peyton, awesome. Thank you so much, Aisa and Peyton. Okay. So I'm a psychologist, and so we're going to pretend that these folks are in my office. So Aisa and Peyton, thank you so much for letting me know that things have been pretty challenging at home. Aisa, it sounds like you have been having these times when you're like doing your homework and you're thinking about having a test the next day and you're getting like really worked up about it to the point that you're winding up getting in a fight with your mom. Is that right? Did I understand that right?
Yeah, definitely. Just sometimes when we're talking, I just kind of want to lash out at my parent.
Yeah. Peyton, is there anything you want to add?
Yeah, it's definitely very frustrating for me. When she starts to get upset, I find myself also starting to just get frustrated as well. Like, why won't she listen to me? Why doesn't she do this? Because I'm just trying to help her do her homework and takes up my time, and I'm stressed out after work, so it's frustrating.
That makes perfect sense. And we see this a lot, right? Like, especially with our loved ones, if one of us is getting really dysregulated, the other one might too. That's so, so common. And partially because you're so connected, right? And you really want to support Isa. Yeah. Can I offer a suggestion, something that's been helpful for other families?
Sure.
Okay. So one of the things that happens is when we're really revved up, we often like aren't able to think very clearly. And so one of the things that can be helpful is to take a little bit of a break and do something to help emotions come down before you come back to the homework table or the discussion that you're having. Do either of you ever do things like going outside and running sprints or doing jumping jacks in place or doing like burpees?
No,
Or
not
have
really.
you in your life?
I have, but sometimes I'll just go for a walk or something, not really so intense.
Yeah. How about you, Isa?
Probably the only time is gym. Not my favorite thing, but
Yeah.
maybe walking will help me feel a little bit better.
Yeah, totally. And I think walking can be great. I would also suggest that you just give this a try, and that would be really intense exercise for a short period of time, like 2 minutes. So that has kind of like a different impact on our physiology than walking does, and it can really help us to calm down quickly. So Isa, I'm curious for you of the things that I mentioned. So thinking about like burpees or jumping jacks or running sprints for 2 minutes or any other kind of intense things you could think of. Is there anything you could think you could try in the next few days?
I think jumping jack sounds a lot more fun. Maybe if I put some music, it'll make it more exciting to do that.
I love that. How about you, Peyton? Would you do the same thing or something else?
Yeah, jumping jack sounds good. I think sprinting, especially because you're saying like do it in the moment when we're kind of getting upset.
Mhm.
Yeah, jumping jack seems more doable for me.
Cool. Okay, awesome. Well, I would suggest, it's hard to practice new skills when we're really activated and upset. And so I would suggest, do you think in the next day or two, you two could make a point of practicing these things? Either the sprinting or the jumping jacks or both, and just notice how that goes for you. And then see if next time one of these fights comes up, if you can say, you know what, time out, let's do our exercise and we'll come back together in a few minutes.
Yeah, I'd be happy to try that. I think that would be helpful for Aisa when she wants to lash out.
Awesome. Okay. Well, thank you. Thank you both so much for listening to that. Okay, time on our role play there. I really appreciate the volunteers. Thanks so much. Do folks have any questions? And intense exercise. So when we share the handouts at the end, we've made some caveats about both intense exercise and temperature. You heard some of the temperature caveats in the video that we wouldn't recommend these things for people, of course, for whom they're not medically safe. So I work a lot with eating disorders, and so I don't recommend these two, temperature and intense exercise, to the folks who I work with because it wouldn't be safe for most of them. But for folks for whom it is safe, I would definitely try these out.
The point about I guess like the timing of it, like I sort of so do we just counsel the parent basically, like, you know what I mean, like if you use your heart's like, I mean, how do you, I mean, I like what you said about like, timeout, but like I guess the timing of it, like, because what happens is like when you're escalated in the moment, people don't want to take a timeout. Like, well, let me just finish this sentence, I have one more point to tell you. And then it's like, how do you counsel the parent and child to like, this is when you sort of need to initiate it or whatever.
Totally. It's a great question. Thank you. So a couple of things. One is I'd always advise that families try to practice this before they're dysregulated, because any new skill is going to be impossible or really hard for us if we're really dysregulated. And I would actually, I know I said it just once, I asked them to practice it just once. I might actually ask them to practice it like every day for a week or two. And it just takes 2 minutes. And then I would really try to emphasize that the parent is the model here. And so even if it's just that the parent says, okay, Isa, I need to take a minute. I'm getting too revved up here. I'm going to go sprint. You can do whatever you want for the next couple minutes. That might be a good start. Because you're right, especially in the middle of a fight, it might be hard to get our family member to do something they're not interested in. I find that young teens are the folks I work with the most. I find that they tend to find these skills pretty empowering and are kind of into them. And most of these skills like feel pretty good and they're brief. And so I find the uptake to be pretty good for the most part.
Thank you.
I love these questions. Any other questions before we move on?
Lindsay, I'm not
wondering-
sure. Oh, go ahead.
Oh, just the space limitation, even in the role play, like jumping jack seemed more accessible to the role players rather than like fast sprints. Are there any other activities that can be done quickly in confined spaces that would work besides jumping jacks?
Yeah, push-ups, sit-ups, star jumps, so like crouching down and then jumping up like this. My colleagues might have other ideas, or anyone in here might have other ideas they can put in the chat. But yeah, great point. Sprinting doesn't work for everybody depending on where they live.
I'm curious, why we went with going for intense exercise in the moment rather than like one of the other facets of tip.
Just for the sake of demonstrating to the group, because we're showing each one a little
But
different.
so like any of them could be something you do in the moment.
Yeah, and folks may find themselves individually drawn to one or the other. And some of these things are more accessible. Like I use paced breathing all the time when I'm driving. I can't do intense exercise while I'm driving. Temperature, we really do need some equipment, whereas some of the other ones we can do with no equipment.
Lindsay, there was a question early up in the chat, and I'm sorry if we addressed it and I missed it, but about I think so, who asked it? Maybe Vivian, about the cold water plunge and if that actually causes our bodies to shiver and do the opposite.
Great question. So this is different than a cold plunge because it's just about like 10 to maybe 30 seconds on the face. And so I haven't seen it cause shivering, but I can see what you mean if we were doing a literal cold plunge that might have a different impact. Yeah. Thanks.
Yeah,
Cindy.
that was going to be my share as well. Is I haven't seen that the face plunge or the ice or holding ice causes that, given that it's localized. And really what it's doing, I always tell families or kids, it's like tipping your body chemistry. Like if you think about, could you do like a math problem while you're doing that? Like, no, right? Like all of your energy, all of your cognition is going to your body tipping itself back into homeostasis. And so that's really the idea versus like a prolonged temperature shift.
Thanks so much. Okay, so for our last skill, could I also ask for another 2 volunteers?
Happy to help out again.
Thank you. And Vivian, thank you so much. Which one of you would like to be the young person, the kid?
We can do that.
Okay, thanks, Peyton. And then Vivian, would you be the parent?
Absolutely.
Awesome, thank you so much. Okay. So we're gonna pretend we're at school this time. That's okay. Peyton and Vivian, thank you so much for coming in to meet with me. I'm the school guidance counselor. I know that we haven't met before, but I'm really glad to see you, Vivian, and Peyton. I know that we've met a couple times, so thanks so much for being here today. So I know that Peyton, you've been having some difficulty, and correct me for anything I have wrong, but it sounds like you've been having some difficulty when it's time to transition to like social situations, like going to lunch or like going to free time at a class, and you've been having kind of the urge to like go isolate or like go to the nurse's office. Did I understand that right?
Yeah, that's definitely accurate.
Yeah, okay. And I know that oftentimes when people feel anxious, their muscles tend to get pretty tight. Do you notice that yourself, like shoulders, neck, things like that?
Yeah, I think when recess is coming around, I just kind of notice a lot in my chest. It's like really tight and I just kind of want to stay alone.
Okay. Vivian, is there anything you want to add? Do you notice this stuff for Peyton as well?
I was just say I've noticed that too, that sometimes she tends to be introverted in more social situations and I've experienced that as well, so it's something that's kind of familiar for me.
Yeah, okay, thank you both. So I wanted to offer a tool that sometimes people find helpful to help calm down when they're feeling really, really anxious. Would that be okay if I tell you about that?
Yeah.
Okay, and I thought maybe we could actually try it together. I really like it myself, and so I thought we could try it together. So this is called progressive muscle relaxation. And the idea is that we take a deep breath in and we tense one of our muscle groups and we hold for about 5 seconds, and then we exhale and we release our muscles. And we can do this for as long as short of a time as we want to, or we have. So sometimes I just do a couple muscle groups and then I have to move on with my day. Sometimes I might even listen to a recording and I can share some with you where it takes me through like a 10-minute progressive muscle relaxation. And that can be really nice if I have more time. So let's just do a couple muscle groups together right now. And anybody else who's kind of in the office who wants to hear can do it along with us. It might feel nice, but that's of course voluntary. So let's take a deep breath in and focus on our arms. So let's tense our arm muscles as best we can, carefully, so you're not getting a cramp, but just hold, 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 and then exhale and release your muscles. And next, your shoulders. So again, do this carefully and gently so you're not giving yourself a crick in your neck, but squeezing your shoulders up and your neck, and inhaling and hold, 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 and exhale and release. And notice the difference from squeezing to releasing. And then finally, we'll tense our leg muscles down to our feet. And so inhaling and squeezing, hold, 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 and exhale and release. And again, notice the difference. Vivian, what did you notice about that for yourself?
That it seemed like a lot of negative energy was just coming out of the muscle groups on exhalation. Sort of just kind of melted a little bit.
Okay, cool. How about you, Peyton?
Yeah, I definitely like felt it loosened a little bit calmer. I think I kind of noticed like what was happening in my body a little bit more than like kind of just worrying.
Cool. Okay. Well, it can be hard to do this for the first time when you're in that time period before lunch or you're really nervous. And so I'd recommend trying this out at home, maybe daily for like 2 weeks. Do you think that's possible?
Yeah, I can try that. It seems like something I can really do anywhere.
Cool. And Peyton, knowing yourself, do you think it'd be best to like practice this with your mom, or on your own? Do you want your parents to remind you?
I'll practice it on my own, but it might be good for my mom to remind me.
Okay. Does that feel doable, Vivian?
Yeah, that sounds great. I'm just curious if there's a particular muscle group that seems to be more helpful than another, or is it just kind of equal?
I might start by, I have this recording that I'll share with you. I might go through the whole recording. It takes about 10 minutes. And Peyton, you could observe for yourself what feels like the most bang for your buck in your own body. Okay. All right. Thank you both so much for meeting with me. Thanks, everyone. Yes.
I'm sorry. Maybe it's just me, but I think I'm just not coordinated enough. But when I was doing the inhale, like is there like something about the isolation of the muscle groups? It felt like I was like tensing my whole body and then relaxing my whole body. Does that have the same effect, or do you really need to like, be more conscious about isolating each muscle group? Sorry, that's probably a dumb question.
No, it's not at all a dumb question. It's a good question. I have always seen this be isolated with muscle groups. I imagine there's kind of a mindfulness component to that because it causes us to focus on one thing. But I can't imagine it would be harmful, and it could be helpful to do your whole body. I think that could be okay. Yeah. Peyton?
I noticed that so for this exercise, the student or the kid was more anxious and the other one was more like angry. Is that kind of why you chose those exercises for those specific symptoms?
Kind of. I'd say that's more anecdotal though. Like I think that anxiety is often associated with tense muscles. And so to me, it feels like a natural link, but you could absolutely prescribe progressive muscle relaxation for any circumstance. I also often use the progressive muscle relaxation recording if I'm having trouble sleeping, because it's just a nice way to kind of like focus and calm the mind. Yeah. Okay. So you can teach one or more skills at a time. We recommend practicing and modeling. When you're working with kids, you might ask them to teach their parents as sort of a way to solidify their learning and also help give them a sense of self-efficacy. And then these handouts will become available to you. And so this is a handout with the full set of 4 tip skills. And so you're very welcome to print these out and have them in your office if that's helpful. And then here at the bottom, there's a note about Virtual Hope Box, which is a free app. It's put out by the VA hospital. And that has guided paced breathing and progressive muscle relaxation. They're named different things in the app, so I've noted that in that note there. And then we have a modified handout, oops, that is specifically for folks for whom the T and the I, the temperature and intense exercise are not appropriate. So this is what I give out to my patients with eating disorders. And then finally, this is a QR code that links to the video from our colleague, Dr. Esme Schaller. She's the one who did the temperature demonstration, and she's the director of our DBT program here at UCSF. And thank you so much for your attention.